Going to be a quick video, one of 3 videos I'm going to do over the next few weeks to help you with stuff you can do at home over the next few weeks, just when some people aren't coming into practice, just with some self-help stuff from home. We're going to do 3 videos. This one's going to be on the lower part of the back, we're going to do mid-back, and then we're going to do the neck as well. Today, lower back in particular is going to be about one of the most common things I see, which is disc compression, particularly on the lower part of the back. We've got discs that go all the way up and down the spine, and the discs are these bits that sit in the center, and they act as your shock absorbers. Most commonly when people come in, some of those have worn out a little bit. In particular, the most common one is the L5S1 disc, which is right at the lower part. And when we do some x-rays, they look a little bit like this. Okay, you see the discs sit in the center, and as we come down, they should get a little bit bigger. And you see this individual person here, we've got disc compression on the lower 2 discs. Okay, what will that present like? Typically present a deep low back pain. It can be sharp, it can be achy, or the whole sort of pain spectrum, it can be like that. And also, because the discs, when we come down, and the discs when we're 18, they should look something like that. But when we get a bit older and they start to wear out, they can even go really small and look something like that. Now, the discs are so important because they maintain this hole where the nerve comes out. If the disc gets smaller and smaller, it can even cause pressure to build up on these nerves. When we get pressure on the nerves, they can present in a number of different symptoms. We've got to trace where those nerves come from to work out what the symptoms we're going to have. The nerves that come out of the lower part of the back control our bowel, control our bladder, our reproductive system, and also control our legs as well. So we're really interested in asking those sort of questions. In particular, people are going to get, this is where people are going to get their sciatica type symptoms: numbness, tingling, pins and needles, and pain down the legs. Okay. If anything of this is resonating with you, and you've been to see me for this before, and you're not currently coming into the practice, is what I'm going to do. I'm going to put a link below to some videos in which I'll go through on helping to alleviate these sort of things from home. If we can get you into the practice, there's some really good things we can do to help take that pressure off, in particular adjusting that lower part of the spine in a particular way to help take pressure directly off the nerve. If you've got any questions, feel free to email me back and I'll happily answer those. And if you can you can bring those to your next appointment when you're next due in. Okay, I hope you're all staying really well and keeping positive, and we're going to get through this together. If you have any questions at any point, just let me know, and I hope to see you soon.